by now, with the second waves, it is more spread all around the province.
The second wave of COVID-19 continues to batter Quebec. New projections for the province show there is a 27% increase in the risk of hospitalizations from the virus, and many are at maximum capacity. New patients coming from outbreaks at long-term care homes, with a 14% increase in cases among those 80 and over in Quebec.
In 3 or 4 weeks from now, we can reach the capacity that was planned for COVID cases in some of those regions, and particularly Saguenay-Lac-Saint-Jean, Quebec region, Chaudière-Appalaches, Estrie, which is the Eastern Township, and also center of Quebec and Outaouais.
If we're not careful about controlling the coronavirus, we could have many more people than usual coming to hospital to be admitted, and our healthcare system could very easily get overwhelmed.
Controlling outbreaks at long-term care homes remains an issue for our province. More and more outbreaks where the elderly are at significant risk of being infected with the virus.
Those outbreaks are specifically associated with some places like long-term care facilities, should it be private or public. We observed that the increase for people older than 80 years old was 64% compared to an increase of about 20% for the rest of the population.
Quebec's Health Minister Christian Dubé tweeting on Thursday confirming that hospitalizations were up outside of the greater Montreal region, and that has many worried. Specialists say they were expecting regional variations amid the second wave and have some suggestions.
Unless we can combat the virus globally, there's always going to be spikes and resurgences of the virus as people move around.
We have to rearrange, if needed, our capacities for some hospitals, and this is what we're seeing right now for some of the hospitals in the Saguenay-Lac-Saint-Jean area, namely.
Meanwhile, the public is being reminded to keep washing their hands, social distance, and wear a mask to avoid spreading the virus. People are also being asked to avoid hospitals unless absolutely necessary.
Speak to your physician, use the telemedicine capabilities that we have. If you don't physically have to go into hospital, don't.
If everyone is taking care of listening and applying the measures, then we should see a really download of the evolution.
In Montreal, Samsara Rainville, City News.